I'm here today with Ashley Haley, our registered clinical counselor. Hi, Ashley.
Hi, Casey. Thanks for having me.
Thanks. Ashley is going to answer some of the frequently asked questions that we get at Remedy about counseling. Ashley, before we dive into those, can you tell me a little bit about yourself and what a registered clinical counselor does?
I did my undergrad here in town at the University of Victoria. I studied a combination of biology, psychology, and business. And then a few years later, I went on to get my Master's of Arts in Counseling Psychology from Yorkville University. So now I practice here at Remedy and a little bit at a local nonprofit. So really, there are three main educated mental health professionals in Canada. There's a counselor, or also goes by therapist, which is what I am. There's a psychologist, and then there's a psychiatrist. So counselors are people trained to provide guidance for personal, social, psychological problems. They really create a safe and empathetic environment where clients can express their emotions and concerns, and it's predominantly a talk-based therapy approach. Psychologists are trained to assess and diagnose in thinking, feeling, and behavioral problems, as well as use techniques and interventions to help clients address or manage those problems. And then you have a psychiatrist, which is a doctor with a specialty in the mental health field, and they can diagnose and treat a wide range of mental health illnesses, and they will often use medication to help their clients manage these mental disorders.
Oh, okay, thanks for clarifying because it can be very confusing when you're entering or trying to look for mental health support and you see all of these different options and it's not always clear what the difference is between those things. So thanks for clarifying that. What can or can't a person talk about when they come in for counseling?
Yeah, good question. Counseling is the process of assisting or guiding clients to resolve personal, social, or psychological problems, sort of what I mentioned in the last question. So, a counselor really just listens to you and helps you find ways of dealing with your own challenges. Counselor is about helping you grow and identify and build upon your own skills and strengths. So, you can really bring a lot into the counseling room. And besides a few situations involving the welfare of yourself or others, all information is treated as private and confidential.
How would I find a counselor if I was looking, and what questions should I be asking while I'm looking?
So there's a lot of sites online like the BCACC, the BC Association of Clinical Counselors, and Psychology Today. They both list a lot of local counselors. You can even look up specific concerns that you're hoping to address in counseling. So I really recommend reading a few bios of counselors currently accepting clients and seeing which one resonates with you the most. Also, when you're looking for counseling, well, not necessary, it can be helpful to have a general idea of what you're hoping to work on in counseling so you can see if those counselors work with those particular presenting concerns.
Okay, so those would be things like the difference between a person who works with, say, eating disorders versus gender identity or couples counseling. Like those would be kind of those are the specific areas you're.
Definitely. Yeah. Or
Okay,
couples relationship problems, all of that. Yeah, Psychology Today is a great resource for that. It breaks that all down so you can find counselors pretty easily.
great. How much would you say that culture and ethnicity matter in counseling?
Yeah, culture and ethnicity are really important in counseling. So, a big factor for the effectiveness of counseling is feeling safe and comfortable. And this can be challenging if you're from a marginalized group. So, I take a culturally sensitive and responsive approach. And so, this means I try and be really open and I value the client's cultural identities, backgrounds, unique perspectives. And then we try and tailor a counseling approach that aligns with who they are as an individual rather than looking at it through a set lens.
What can a person do to prepare for their first appointment?
Definitely not required. It can be helpful to come into counseling with a sense of what you would like to work on or discuss. But if you don't know, you kind of just have a general sense, we can definitely talk about that together and create some therapeutic goals together. In the first session, I typically just get to know you and you get to know me a little bit. So I might ask some questions to help understand what brings you to counseling, get to know you. Feeling nervous before the first session is very normal, especially if you're new to counseling. So even bringing up those feelings with me in the first counseling session, and we can talk about this together, might ease some of those feelings. But really, we might send along an informed consent form before the first session, and that's always great to fill out and see if you have any questions about that and bring that up too. But yeah, besides that, it's pretty open.
If I was coming for counseling, how can I get the most out of my counseling sessions?
I would say trying to be present during the session, coming in, being open and curious towards the process. Um, but also like bringing up any feelings of discomfort you're experiencing so we can discuss those together, maybe address some underlying fears or just change our approach entirely if it's not jiving with you. But similar to learning anything new, like learning a new language or learning a new instrument, change does take time and it takes effort. So it's really just being open and patient with that process and seeing where we can go with it.
And how often do people go for counseling? Is it something where you have to come in a couple of times a week, or it's a once a month, or is that unique to the individual person?
Yeah, it's really dependent on a few factors. So research seems to suggest that coming to counseling weekly or bi-weekly at the beginning is really the most effective, but it also really depends on what you're coming into counseling for, and how helpful you're finding the work. And in addition, sometimes there are just scheduling conflicts, financial constraints, other personal reasons that would be barriers to frequent visits. So your time in counseling can be tailored to how much time you can put into it and how much you're able to afford. A lot of uh, workplaces do provide some mental health supports too with their benefits packages, which can be a huge help in this case.
And I would imagine the fact that you offer both in-person and online counseling makes it easier for people to access your services. If they can't physically make it down to the clinic, they can still get in touch with you online.
Definitely. And yeah, and evidence does suggest that both virtual and in-person counseling are equally effective. They're just a bit different, but you
Okay.
still get that connection. But it's good to know.
Is it okay for a person to skip a session if they're not doing well?
Yeah, most certainly. I mean, in counseling, I really hope to encourage self-awareness and recognizing personal limits. So recognizing when you need some time to yourself and honoring that is really great. That's a big step. But that being said, it is preferred that you try and give us as much notice as possible, just in case somebody else might be able to use that spot. But obviously, we're very understanding towards emergencies and personal difficulties. But depending on what is causing you to not feel so well, a counseling session might be able to provide some relief or assistance. So it really just depends on what you're going through.
How much should I expect to pay for counseling? And how long should I expect to need to go?
Yeah, so counseling rates are set in accordance with the recommendations of the BC Association of Clinical Counselors. And so right now they recommend a session rate between 135 and 150. It really also depends on the years of experience of the practitioner. So right now at Remedy, our sessions are going at $135 for a 50-minute session. And for frequency, it really, once again, depends on what brings you into counseling. So I mentioned some research. So research suggests that, people usually see quite a large reduction in symptoms from 15 to 20 sessions, but some people might find just a few sessions is enough to set them on the right path. Um, and if you're unable to afford counseling, there's so much amazing online resources right now for mental health. There's government websites, YouTube has tons of resources. There's also really good books out now, really great podcasts. So, really, just taking a bit of time and doing some research and finding something that feels comfortable for you and might be, achievable. But yeah.
Yeah, we do live in the age of information. It's all out there, right?
Yeah. Yeah.
Awesome. And how do I know if my counselor and I are a good fit?
Yeah, that one is definitely just listen to your heart, trust your gut. It's very normal to feel a bit uncomfortable at the beginning of counseling, especially if you've never been to counseling before. So, a bit of feeling of unease at the beginning is normal. But if that feeling doesn't lessen, after a session or two, then it might be time to just check in with that. It might just be not a great fit for you. Just like you wouldn't become friends with everybody off the side of the street, you might not fit with every counselor, which is totally normal. So just, honoring your feelings and seeing, if another option might be better.
How do I know when I'm well enough to stop seeing a counselor, when we've achieved, the goals that I initially came in to address?
Yeah, that I think would just become clearer to you with time, right? Some people, as I said, find that just after a few sessions, they feel like they have enough tools and resources to kind of go off on their own and apply that and maybe come back in the future. Others end up seeing counselors for quite a few years. They just find that regular, consistent support a huge benefit to their healing journey. It really comes down to what feels best for you and what support you're looking for and what your goals are. But really, counselors should periodically check in with you as sessions progress just to see how you're feeling towards meeting your counseling goals and yeah, trust how you feel.
Thank you so much. Um, Ashley is accepting new patients here at Remedy Wellness Center for both in-person counseling and online counseling. You can find more information about Ashley and about her counseling services on our website, remedywellness.ca. Ashley, thank you again for taking the time to answer those FAQs, frequently asked questions. We get those coming through our email and chat to our admin team on a regular basis. So it's great to be able to provide people with that information. Thanks again.
Yeah, thanks, Casey.